questions about rib removal, so we're going to kind of run through that real quickly. First one is, who's a good candidate? You really want to be pretty thin. If you are pretty heavy in here and have extra fat, we can just contour that with liposuction, which is a little less invasive. So you really want to be really thin. Then when we take the ribs out, you can really see that change in your waist. It's also really good for transgender patients because it gives you those secondary sex characteristics, particularly if you're male transferring into female, because then you get that curvature that helps make you look more feminine. What it really helps do is give you that hourglass figure. If you think your ribs kind of hold your outer portion of your waist here, and when you take the ribs out, it comes up just a little bit and also allows it to sink in further. So you get a deeper cut and like a narrower waist from that. You can function just fine without your ribs. A lot of people worry, does it affect your breathing? It really doesn't. We're taking out 10, 11, and 12, so that's a false rib and 2 floating ribs. They really don't have any physiological change with your breathing, but they do protect your kidneys. So I did have somebody who was a kickboxer, and I was like, well, you probably don't want to do this operation because it might damage your kidneys if you get struck there. So that's one issue with it. They don't grow back. Did have one patient get a little bit of speckling along there, and we've been watching it. It's not really like Adam and Eve, where they pulled the rib out of Adam and it grew back and it became a woman. They really, once they're gone, they're gonna be gone forever. Pain level, it is a pretty sore operation. Most people take a week off from work. Second week, probably half, maybe 3/4, and we'll go back to work. If you can take 2 weeks off, that's nice. But most people after 2 weeks are back to work. Big things like, activities like golf where you're swinging your whole body, you really won't feel your total self till 6 to 8 weeks. So it just takes a while to get all of that back if you're really attuned physically. Some people will ask if they can keep their ribs. You totally can. That's your choice. It's just up to you if you want to take them with you. And then you really want to find somebody who's had experience with this or comfortable. In my residency, I did a lot of rib removal, so transitioning to this as a cosmetic procedure was very easy for me. And lastly, our scars. So the scars are really small. For rib removal, are about 5 centimeters, so about like this, and they're usually a little bit higher than people think, just a little bit below your brow line. And then for a rib in fracture, they're smaller, so they're about 3 centimeters. So it's a real small, discrete scar. And those are most of our basic questions with rib removal. If you have anything else, DM us.